Hello, welcome to my channel. My name is Marian. In today's presentation, I am going to be talking about imaging the pediatric patients. I do work in radiology, so I will get into the lesson now. Why would a child need an X-ray? So as an X-ray tech, or if you work in CT or MRI or any other radiology modality, if a child need an X-ray, the main reasons would be to diagnose conditions such as broken bones, suspected internal injuries, if a patient swallow foreign objects or inhale foreign objects, for lung infections, dental issues such as cavities or maybe a chipped tooth, and trauma related reasons. And this x-ray right here is an image of a fractured bone of the forearm. I know whenever I was 7 years old, I did fracture my forearm. So if a patient come in and they are a child or maybe a baby, just try to be as patient as possible with them because they may be afraid. I know I was afraid because a lot of people was around me whenever I had to go inside of the x-ray room. So whenever we see that big camera, whenever you are a child, you probably tend to get scared. But I have had children that was 6 and 7 that didn't have a problem with the x-ray machine. So I would just make it fun. I would tell the child that it's just a big camera, make sure they smile and hold still for the picture so that it can just help them ease the problem or ease the stress of the x-ray and what to expect. And then I have another image just showing the fractured bone. And it's saying that the forearm is one of the most common bone fractures with pediatric patients. So if you are an x-ray tech or a CT tech and you have children or a lot of pediatric patients come in, pay attention to see where the most common fractures are or what area that you see is getting fractured the most whenever you are performing your x-rays or CT scans or even MRI scans. And a way to treat fractures in children, you have your cast, you have your splint. If it is bad or if the doctor recommends surgery, that may be because the fracture is too complicated. So that's when metal pins or plates will be placed in the area where the fracture is at. And then you also have suspected internal injuries. This can be related to child abuse, car accident, any type of traumatic injury to the internal organs or the chest, abdomen, brain. This could be due to, let's say, a baseball bat injury if a child is playing sports, or a football or a basketball have accidentally injured a child. This can be for several reasons, and several x-rays will be ordered and or a CT scan. And then if it is suspected of, let's say, child abuse, then x-ray skull and all the way down to the feet will be ordered. And then you have your image of a skull for a pediatric patient, and then you have an image of a hand for a pediatric patient. And then this is an example of a foreign object that is seen on an x-ray whenever a baby or let's say a toddler come in and they have swallowed something. And this is like an example of a foreign object if you would see this on an x-ray image. And then you have another example. And then whenever you do have to put in notes, I would just say to rule out foreign object or patient swallowed a foreign object 2 days ago or 2 hours ago. You also have lung infections, to rule out asthma, croup, pneumonia, bronchitis, the flu. Chest x-rays can be done on babies, especially if they are in the NICU. It can be done on children in the emergency room department or in an outpatient clinical setting. And this is an x-ray of like the chest. This can either be looking at the lungs or the entire chest, depending on the symptoms the child came in with. And then you have your pigostat device, mainly for little babies, especially to help stabilize them and immobilize them to keep them from moving, especially if it's maybe their first time or maybe they're just scared or nervous. Then this device will help them hold still. And then you see the picture where the baby has their arms up perfectly so that you can take an x-ray of the chest and the full lungs. So this is that example. And then you also have dental problems. Now, as radiologic technologists, we do not x-ray teeth for dental related reasons. This would have to be done in a dentist's office, maybe with a dental assistant. But if we do image the teeth, let's say it's probably not, or it's not related to any type of dental problems. It's related to something like the skull or maybe like a jaw injury or a nose injury, but it's never to check for cavities in radiology. And then you have your trauma incidents. Um, you see like different fractures right here. You see something going through this baby's abdomen. And even if this is just like examples of what a trauma incident would be. And then other examples of like what could be a traumatic incident for a child or a pediatric patient. You have dislocations, you have fractures, crush injury from a car or a heavy object. So these are just different examples of what trauma incident can happen for pediatric patients. And then you have your abdomen x-rays. So abdomen x-rays can be ordered to diagnose pain, blockages, holes, foreign objects, kidney stones, gallstones, tumors, to place a tube in the patient's abdomen to help with feeding. So this is an example. You will see the entire chest and abdomen on this patient. Okay, now we are going to talk about the important considerations, and this is to minimize radiation exposure, meaning make sure that you are selecting the correct KVP and mask. If you work at a facility where you do not routinely perform x-rays or CT scans on pediatric patients, make sure that there are or is a protocol in place, especially whenever patients come in, kids come in. There is a protocol and parameters set for that child, and that you are not exposing them to radiation that adults may get. So that is very important to also check your KVP and mass, especially if you are imaging, let's say adults, and then a pediatric patient come in. So you just want to make sure that you are paying attention to your parameters, and then also make sure that you are shielding your patients. If you are taking an x-ray, let's say of their skull, make sure that you shield the gonads area, the protective or the sensitive areas. And then you also want to make sure that you provide a lead apron shield for the parent or the guardian as well, any family member that will be in the room. And then patients may have questions about the benefits and the risks of radiation. And normally the healthcare provider do explain this to the patient, but if they forget to ask, as an x-ray tech or a radiology tech, just be comfortable enough to explain the benefits and the risks for the patient or the family member to understand. Now we are going to talk about CT scans for pediatric patients. If a CT scan is ordered on a pediatric patient, it is to diagnose injuries or trauma, abdominal pain, infections, cancer. You also have diagnosing fractures or difficulty with breathing. This is an image of a brain or CT head for a pediatric patient. And whenever you do have to provide imaging on patients, make sure that you provide clear instructions to the patient and family member, especially in a way for the child to understand. You can tell the child to hold still, pretend that you are playing a game with the child. You can say, hey, hold still like a statue, or let's see how long you can hold still for. Or you can say, let's play the quiet game where you don't move. Or you can also just tell them, hey, just hold still because I'm going to take your picture. This is our big camera. So just be fun and creative whenever you have pediatric patients, because some patients may be scared and then some patients may be brave. Make sure that you have patience with kids. You even have to have patience with adults as well. So just make sure that you are communicating well with the patient. Realize and understand that the patient may be afraid or they may be nervous. It could be their first time, especially if they are high off the floor with the table being raised up. Just let them know, stay on the table so that they do not fall or injure themselves. You can also put the safety belt across their waist just to make sure that they know not to get up. Provide shielding when possible. If you are taking an image, let's say on a patient's skull or chest, you can shield the protective areas or the gonads. Just make sure that you provide the shielding also to the parent, family member, friend, or guardian if they have to stay in the room. So we have different shields. You have the full apron shield, you also have a waist shield, and then the last image you have a thyroid shield. Now we are going to talk about MRI scans on pediatrics. An MRI scan will be ordered for head injuries, seizures, headaches that will not go away, developmental delays, if you have spinal cord injuries, any type of joint pain, bone abnormalities, if a tumor is suspected, any type of inflammation. So these are just different reasons why an MRI brain scan will be ordered, and or an MRI scan in general will be ordered. And then you also have a picture of a sagittal MRI brain scan on a pediatric patient. And then this is just an example of how an adult MRI brain scan will look. And then you have the pediatric brain scan that is closer to me. This is how that will look. So, the safety for children, you want to make sure that you provide headphones and or earplugs or even earmuffs that is protecting the child's or the baby's ear, especially if they are a newborn. Depending on the age and how well the patient can hold still and tolerate being on the table for a long time, the patient may or may not need to be sedated. And then it's also good to have maybe like a family member in the room, and then you can have a child-friendly environment to help keep patients calm. I do have a MRI safety presentation that I will link in the description box because it will cover like all the safety issues and concerns with MRI. So you can just watch that video where it just go in further details and further in depth of how you have to prepare for an MRI scan, how you have to hold still different objects and metal objects you can or cannot bring in the room. Well, that's it for this presentation. I hope you all enjoyed it. If you did, you can feel free to like the video for more videos like this. Also, feel free to subscribe if you want to. Well, if you have any questions, feel free to leave it in the comment box for me. Well, other than that, I hope you enjoyed this presentation and thank you for watching.